Good morning, good afternoon, good evening, wherever you are connecting to this webinar from. I want to welcome all of you to join us today for this discussion on where do we stand in terms of the pandemic, the response to the pandemic, the economic outlook in Africa, and what should be the response of the international community going forward. And it's a timely conversation because October is the month during which there are a number of international gatherings. We have the IMF and World Bank Annual Meetings in about 10 days' time. And at the margins of that, there will be meetings of ministers and governors from different constituencies, including the G20, the G7. Later in the month, we have a meeting of the G20 leaders coming together, and then that segues in the first 2 weeks of November into the COP meeting in Glasgow. So a number of conversations, next to official conversations, and I thought that before we get into them, it would be useful to just take stock of where we are and what our view should be done, should be the outcome of these meetings. We have a great panel to get us going for this. I'm going to start first with Dr. John Kengasong, the director of the CDC in Africa, and the CDC has really been one of the stars of this last year and a half in terms of rising to the challenge. And then I'd like to turn to Minister Ken Ofori-Atta, who's the Minister of Finance for Ghana. And I want to get from him a little bit of a sense of sort of being on the ground as a finance minister. How is the outlook looking for the next 6 months and a year, and what would he like from the international community? Then I'm going to turn to Gordon Brown. And I was going to say to Gordon that you've been at the center of a lot of G7, G20, IMFC, World Bank discussions over the years. And in a way, what would be your expectations of what they should be doing right now, given what we'll hear from John and from Ken? Welcome, Ken, to the conversation. I see your videos on. And then round it off, I would come to Vera Songwe, Under Secretary General and Executive Secretary of the Economic Commission for Africa. ECA has really become the place where African finance ministers and health ministers have been coming together to think through their common approaches and strategies. And I know that in the run-up to the annual meetings, they've met, and this would be a good moment to get from Vera a sense of what is now on the minds and expectations of African economic leaders, yourself, in terms of the upcoming meeting. So that's a sort of plan of action. And I'm going to jump right into it because we don't have that much time, and there's a lot to be discussed. So John and Kengasong, could I start with you, please? So do you think things are going to get worse over the next few months before they get better? There are a lot of conversations about vaccines not being delivered. And there are also a lot of people who are saying, well, that's a short-term problem. By January, February, we'll have an excess supply of vaccines, and the problem will be the ability to actually take vaccines and convert them into vaccinated people. A lot of people are saying, yes, but we should really also be focusing on manufacturing capacity for the medium term. So from where you sit, how does the outlook look to you in terms of the pandemic and the health response to it? So maybe just take 5 minutes and give us your view, and then we'll come back to you.
No, absolutely. I think, Masood, you said it all. Let me first of all start by extending our greetings to the panelists. But you said it all because you characterize it the way I see it, that the situation is likely going to get worse in Africa before it gets better. And this is why we, as a continent, as of today, we are reporting 8.3 million cases of COVID with about 211,000 deaths. Many countries, the 44 countries that were at the top of the third wave are now coming down nicely, but at what price? I mean, a huge human cost, we've paid a huge human cost during the third wave with close to 80,000 deaths just within the last 2.5 months that the third wave lasted. And so if you put that number on the total cumulative number of 211,000, you see that 40% of the deaths occurred over the last 2.5 months on the continent. That tells you that this impact of waves, where if we keep living from one wave to another, then who knows what the fourth wave will look like. As we speak, 7 countries are moving towards the fourth wave on the continent. And we have analyzed the data, and the finding is clear that every wave, when you come down to the trough, you stay there for 2.5 months, then you go back up. Okay, that's what we saw between the first wave and the second. We saw that same trend between the second and the third wave. So who knows what the fourth wave will come in. But just keep in mind the aggressive nature and the brutality of human lives lost when these waves occur. Now, the only way we believe that these waves will be minimized is access to vaccines. But unfortunately, as a continent of 1.2 billion people, or 1.3, depending on which number you're using, only 4% of the population has been fully vaccinated with their two doses, or 6% with at least one shot. So that doesn't really speak well. Let me just maybe conclude my comments by giving the denominator. We as a continent had established last year that we will need to vaccinate up to 60% of our population. Today we are at 4% fully vaccinated. The denominator, that is the number of vaccines required, there is about 1.6 billion. So I say this because when people make donations to Africa, we appreciate that. But we say, well, you have to always put that in the context of what the total needs are. And if we revise that 60% target up to 70%, which is the new target put forward by WHO, that increases the denominator a lot. So we are really, really far from getting to where we are supposed to be to assure ourselves that this pandemic will be controlled or even eliminated from the continent.
Thank you very much, John. That's super helpful. But just before I move on to Ken, can I just ask you one question? So how confident are you that by, let's say, January, February, March, at the latest next year, the world will be producing 1.5 or more billion vaccines every month, and we're going to go from a shortage of vaccines to a how to use the stream of vaccines coming on? I mean, I hear this a lot, and I want to get your sense, as you're right in the middle of it. Are you feeling confident that that's what's going to happen?
I wish that was true. And we said this, remember this is, we are in October. In spring or so, we said, oh, by September, we'll be all swimming in vaccines on the continent. It wouldn't be a problem. I remember in certain dialogues, people were telling us that don't go get vaccines because you have excess vaccines in August and September, right? This is, and the same narrative we are hearing there. I think we have to admit that the producers of vaccines are challenged with the capacity issue. Unless you really transfer that technology and decentralize manufacturing, in January, we can still have this conversation and the needle wouldn't have changed. I think that is the reality. Most of these companies miss their targets by over 90%.
Great. So we will have another conversation. Let's put a marker down. And I think it would be good to have that conversation at a time to see whether, in fact, these various projections on which people are saying, don't be so worried, turn out to be reality or not. Ken, can I turn to you next, please, first of all? You remember almost to the day 6 months ago, in the beginning of April, we had a session that you and Vera and I were all on. And I sort of said to you then that you were a lot more optimistic last April than you had been 6 months earlier. And I think you were pretty confident then that there would be a movement forward so that we would see some results by the time of this upcoming meetings in October. In the meantime, the numbers for the world outlook had been moved up by the IMF, growth numbers, but the numbers for Africa and low-income countries are in some cases being moved down rather. And I want to get a little bit your sense, both in terms of how you see the outlook going forward, but also how confident and how optimistic are you feeling about everybody speaking the same language, recognizing the problem and moving forward? So your initial thoughts on that would be great, and then I'll turn next to bring in Gordon Brown. So over to you, Ken. I think there you go.
Yeah, thank you. Thank you very much indeed. And good afternoon to you all. Gordon, we haven't seen you in a while. You look well. Thanks, Masood, for this platform. I think, as you listen to John, you really get these sort of panicky feelings inside you because it has become hydra-headed. And the long COVID issues have not even been confronted with. So we talk about another 425 billion as a number that we need to close that gap. That's a problem. If we were to assume the number of doses that John is talking about. I know we've been able to put a 2 billion facility in place through AfriExim, and there's a lot more, as he mentioned, that needs to be done in the wake, Masood, of increasing debt distress, which means premiums for getting financing escalate, and then our lack of presence in the global supply chain, which means that in contributing only 2% of our health needs, we're going to have to spend a lot more to be able to build forward better. So it looks very difficult. And the challenge for me philosophically is we, in a sense, agreeing that this is a global good, which then has to be funded. And somehow for Africa to be put in a position to finance this global good so that the world will be a better place in a system in which, our economics are worse because of debt distress, etc. And I'm trying to get my head around the thinking which says that we should go and borrow to save the world, create difficulties in our capital structure, come back to borrow from you to support that, and an environment in which, we have about 103 million jobs at risk and increasing poverty. So yes, it almost feels like I'm growing up to understand that the world works in a very different way, even when the statistics are clear about that. And therefore, what type of advocacy is required to really interpret this whole apocalyptic event as something that, is a collective effort, and how do we fund WHO or COVAX to ensure that we rid the world of this messes. And that, Masood, I guess, is my issue. I look at myself personally, and I went through the COVID experience and then the long COVID experience. So a Minister of Finance loses maybe a third of the year in productivity. Now, if you use that to translate across a region of 1.3 billion people, you see the reason for our productivity coming down, the contraction that we have, and therefore the fragility of the future that we face. And until the thinking is different, because you're beginning to sense a normalization of events and, issues of moral hazard, and therefore, how do you fund this? So yes, I am not as optimistic as I used to be, and it has been exacerbated by the various variants that are also coming, which puts South Africa in grave jeopardy. Thank
Thanks
you.
very much, Ken. So I think that let's just hold that thought, because you also raised 2 points I want to come back to in a minute. One is this issue of debt. The debt numbers not getting any better. The systems we put in place, the mechanisms that have been put in place, this common framework to deal with the debt problem, so far haven't got much in terms of any country is actually being coming out of that framework yet. So it's a bit slow. And the second issue that you raised is the need for continuing finance. And it'd be good to come back and have a conversation about whether the MDBs, the development banks and the IMF are geared up to respond at that scale, not just for 1 year, but for the next 3 or 4 or 5 years at least, when this will be needed. But I want to bring Gordon in first, if I may.
Masood,
yes,
one
please,
second.
Ken. Go ahead. Sorry.
I think one of the Achilles heels of being the world coming together in a way is, let's say, for example, the G20, which brought the EU to get a seat, so that the thinking of EU beyond the G20 comes through. I mean, it's really, and I think maybe Jeffrey Sachs would say, why should Africa not have a seat at the G20 permanently for 1.3 billion people, for that type of GDP, for a future in which we are going to be a quarter of the world's population, so that the thinking and the empathy and the intimacy, may change from an 18 trillion capacity to intervene, and 2% of our GDP to intervene may make those changes. So those fundamental shifts for inclusiveness and collective action may also need to be taken. Thank you.
Absolutely. In fact, I think one could go one step further even and say that almost there's no problem that we are now faced with of international nature, whether it's climate or global health security or artificial intelligence management, where you can find a solution without the active engagement and cooperation of emerging markets and developing countries. Just the numbers and the demographics mean that. And that means that our systems now for engaging that set of countries in the decision-making and policy-making to address those problems needs to reflect that much better than this is done in the past. Because I think historically, the problems the world was trying to address maybe didn't require the same degree of engagement to be dealt with. But going forward, I think if we don't address this problem, we're not going to be able to address the issues that we're trying to solve. So I think that's a very central point, how we get there. So Gordon, I think you've heard John and Ken, both their perspective. And as I said, you were very much in the center of this, and you've been writing very powerfully and speaking on this. What would be your take on it? And what advice would you have for your successors in these meetings?
Well, let me first of all thank you, Masood, for organizing this and for the work of the center. And I was moved by the very powerful statements made by John about the need for vaccines and for action, and by Ken, his powerful statement about the need for finance and the need to think very carefully that it's in all our interest, not just in Africa's interest, that Africa is vaccinated as quickly as possible. And I'm looking forward to hear from Vera, and I know the great work that she does. You were asking me, what should the IMF and the World Bank meetings and then the next G20 meeting succeed in doing? Well, the first thing is vaccination. We've got to get a month-by-month global delivery plan to get the vaccines out from where they are to the people who need them. I've been working with a group called Affinity, and they now estimate that there are 300 million vaccines unused in Europe and America. By the end of the year, that figure will be 1.2 billion. John has just told us what is needed by next year. And the key is to get these vaccines used now to save lives. And by the end of the year, 100 million vaccines will be wasted. They'll have been past their use-by date if we don't get them out to people. So what I want to see, and this is really 4 countries, America, Canada, the European Union, and the United Kingdom, have got access to the most of these vaccines at the moment. And I want a plan month by month to airlift these vaccines into Africa and into other low-income countries, so that we can actually, having failed to meet the 10% target by the end of September, we can actually have a chance of meeting the 40% target by the end of the year. And it is possible. Now, the vaccine summit was the best chance to do that, but they agreed about the long-term vaccine availability. So America offered 500 million more, and that's great. Europe offered about 200 million more, if I'm right. But what we need is a month-by-month plan now. So that's the first thing that I think is really urgent. And the more that African leaders can press for this, and the more we expose the fact that people are hoarding and stockpiling vaccines at the moment, and that there is no need to do so, because by the end of the year, we'll be producing 2 billion vaccines every month. The more we can get this message out, the better. Now, then the financing of it. So COVAX has been financed for much of this year, but it needs money for next year. So I still believe that there ought to be a burden sharing agreement between the richest countries, just as we do for UN peacekeeping, just as we do for $1 billion of the World Health Organization's money. There should be a burden sharing agreement so that each country contributes according to its wealth, because this, as everybody has just said, is in everybody's interest. If we don't stop the virus in Africa or in the low-income countries, it will hurt not only them, but come back to hurt us all. And what shocks me is for John to have to tell us that 80,000 deaths have happened since 1st of August in Africa. Now, if we'd had the vaccine out at the time that it was being promised, then that number of deaths would be substantially less. And we really have to do something about it. We might come back to the issues of the African economy and the responsibilities of the World Bank and IMF. But I just want to say one other thing. What we must make sure is that when the vaccines are available, we have the capacity to administer them. And so whether that's asking the World Bank to do more than it's done, or asking COVAX and Act A to give more money, let's get that organized so that whenever the vaccines are available, and we can get them as quickly as possible, I hope, then we have the administrative capacity to discharge them and administer them properly. I just think this is urgent. It's about lives being saved. Yes, the IMF and the World Bank can make lots of decisions, but I think there are 4 countries that could actually change the balance of vaccine distribution overnight, and they could be airlifting supplies now, and the pressure's got to be put on them, as I am trying to put the pressure on, but I hope we could have more pressure from Africa.
Thank you very much, Gordon, and thank you for focusing on that immediate issue. So, it seems self-evident what you've just said. It seemed like an obvious thing to do. You're going to waste vaccines, going to run out of their expiry date, and they could be airlifted now. There's 4 countries, it's manageable, or 4, including the European Union. So can I just ask you, what will it take for those countries to do what is so obvious, and why is it not happening? And I think, if somebody's watching this, they would say, well, that just seems like such an obvious no-brainer. Why is it not happening?
Because they've misjudged the situation in the richest countries. They've over-ordered and over-stockpiled. And at the same time, they think that if they promise vaccines months ahead, that's enough for Africa and the low-income countries. What they haven't realized is they've got this stock now that if they brought it together, they can get it airlifted out. So it's actually a lack of political will to coordinate our effort. And that's why the vaccine summit was the way to have done it. But having failed there, to get the delivery plan and no vaccine summit till January, I'm suggesting that we get these 4 countries together and get them to agree that they will give the vaccines that they've got in excess and get them out to people as quickly as possible. So I would like you to press these 4 countries to have a meeting whether it's at the IMF or the World Bank, or whether it's separately, and do so. And by the way, on the G20, I agree with what Ken's saying. When we created the Leaders G20, there was not only membership for South Africa, but there was a place for Africa. And it was taken up at that point by NEPAD, by Prime Minister Meles of Ethiopia, who sadly died. I believe that the G20's membership should be extended, should be more representative, and of course, if necessary, we should do a constituency system like the IMF. But the G20 is what we've got. We're not going to get another big architectural change in the next few months. So press for African formal representation, and say that in the long run, we've got to change the nature of the G20. Remember, it came into being to redress the balance where Asia was losing out to Europe. Now the balance is the rest of the world is losing out to Asia, Europe, and America. So we've got to do something about that.
Great. So I'll come back to the other point that you said about the role of the IFIs going forward. But before doing that, Vera, could I turn to you, please? So you've got ideas right in the back of you, and I know that that poster saying ideas is very representative of a lot of stuff that is coming out of ECA with a lot of ideas. I know you've had a meeting of finance ministers, the annual meetings are coming up. What is the expectations? What is the ask, if you like? What would we should get out of the meetings from your perspective?
No, thank you. Thank you very much, Masood. It's always a pleasure to come back to this conversation. Gordon, nice to see you, and thank you for all the advocacy and being at the forefront of this. I think your voice, please keep it alive and keep it loud. We need it. Of course, John and Ken, we're in the fight together. Now, listen, three things, Masood, right now is one, the main, and I think just the headline message is Africa is not on the recovery path yet. And so I think all the conversations on recovery, which seem to begin to, be what is sort of taking center stage in the emerging markets and of course in the West, are not yet, on the continent. And the reason is very simple. We cannot be talking about recovery when we are not vaccinated. And I think I'm not going to go over what John and or Gordon have so eloquently said. And so we need those vaccinations to happen. And if those vaccinations don't happen, we're not going anywhere anytime soon. And so that's the first thing that we asked. And I think there has been a debate about whether the IMF should be, helping on the vaccine side. Of course, the sort of recovery starts with financing. Where do we get the financing? The SDRs. Very happy that the G20 approved, a new allocation of special drawing rights, a historic 650 billion of special drawing rights. But we're now pushing for on-lending. Why are we pushing for on-lending? Africa only got 5% of all of the SDRs, for which we lobbied, vehemently for. And, the G7 economies are getting almost 41% of that, to the tune of something about 282 billion SDRs. There's going to be a lot of talk about, foreign reserves. Those $282 billion of SDRs are about 1% of the G7's reserves. So there's not a huge macroeconomic monetary policy issue about that. So the first thing we are asking for is, can we have a vaccines facility created? As Dr. Kengasong has said, we're probably going to need vaccines, not just for the first and second shot, but over a 3-year period. We've estimated that that's going to cost Africa about $24 billion, or maybe more, depending on which vaccine you have to buy. This is new debt on a continent that we know has been resilient, by the way, because when the crisis began, there was a lot of talk about Africans, about to go into debt defaults and debt distress. Africans have been quite resilient, thankfully, sometimes maybe to agricultural prices that have sort of stayed and are beginning to go up, oil prices for some, like Nigeria, that are now hitting record levels. But I think we do need to ensure that when countries borrow for vaccines, they don't create huge debt. And so what we're asking for from the IMF is a purchase of vaccines is a balance of payments operation. And we believe that using SDRs, we can create a vaccines facility. That's the first thing. The second thing is the IMF acted very quickly, and for the really, really low income countries, was able, using the PIGT and the rapid credit facility, to actually stave off the debt of some of these low income countries. That should continue. We should do more. We should do it faster. For market access countries, we still believe that there is more that can be done. the Economic Commission for Africa, of course, is pushing for a liquidity and sustainability facility, which will help Africa create a repo market. Prime Minister Gordon Brown is here. The repo market started in the UK in the 1800s to level the playing field, to allow for recycling of liquidity, and to ensure that both businesses and governments could actually finance crises. Proof, the United States has just decided to create permanent repo facilities to respond to this crisis. So why not the emerging market economies? Why not 50% of African countries today that have market access, but that have very high and expensive market access because they don't have the institutions to manage it? And I'm saying that this crisis is so big, so large, so deep, so prolonged that we cannot fix it by using the old things, creating a small trust fund here and a small, we need to change fundamentally institutions that respond to Africa's access to liquidity and finance. And this is one of those ideas. We can use the SDRs to create trillions for Africa because we open better market access. We hear that, you know, the private sector, particularly because of climate change, has $13 trillion in the markets that they're willing to give back. I was just on another panel with President Kenyatta. Kenya, not many people talk about Kenya. 90% of Kenya's energy is renewable. But when Kenya issues an SDG sustainable green bond, the cost of that bond is just as expensive as a plain vanilla bond because we don't have any facilities that give us any extra credit for green bonds as we will get when we're in the developed market. So I think we need to look at, can we create institutions that allow for Africa better access to financial markets, to more capital at non-onerous rates? So that's one of the things we're asking. And of course, the whole climate change debate. The IMF is putting on the table a resilience and sustainability trust, which is going to look at how do we finance climate change. But we in Africa are also asking for a price for carbon. How can we get this debate back on the table? How can we ensure? We do talk about domestic resource mobilization. We forget a lot of times, and yes, it's true, we always talk about the 100 billion that was promised us. But I think that let's keep the 100 billion that was promised us and just ask, can we get a price for carbon? And many African countries will actually be able to raise resources that can then begin to address issues of development. So these are some of the things. And then of course, some of the SDRs, could they go to the World Bank? Could they go to regional development banks so we can respond to our private sector and how our private sector can grow out eventually of this crisis, including through the manufacturing of vaccines and pharmaceutical commodities.
Thank you very much. Thanks, Vera. So SDRs, using them more creatively, both in terms of vaccine facility and supporting the LSF, the liquidity facility that you talked about to introduce a repo market in there, thinking about ways in which you can, by using a carbon price, give countries an opportunity to be able to raise resources. So I think there are a lot of these ideas on the table. It would be good to talk a little bit about the SDRs. As you know, we at CGD had put forward a proposal for a vaccine facility at the IMF, now almost quite a few months ago. And my understanding is that that's a proposal that can be put into place very quickly. It doesn't require a lot of work. The technicals is very simple. And really, it's just a question of getting the sort of political message from the shareholders of the IMF to say, we want to have such a facility. You could provide very quickly a response. And similarly, as you said, you could use the SDRs not just to support the low-income lending by the IMF, the PRGT, and this new resilience and sustainability trust, but also think more creatively about using SDRs for the multilateral development bank system, having a bigger role for them. I think all this is really about reimagining the IFIs for the 21st century and playing a much bigger role using different kinds of facilities to mobilize private financing more than they have done and to take on the sort of global public goods agenda than they have done. And I wanted to get a little bit sense from the other panelists in terms of what kind of role do we think the IFIs can play in this space that would be different from their traditional activities? Is it just a question of more, or is it also a question of taking on different kinds of risk appetite, different kinds of instruments, So maybe I'll come to Gordon. Could I come to you first? Because I know you've thought a lot about this. And then I'll come to Ken and I'll come to John with the specific dimension of this.
Well, we've got three huge priorities that have got to be met very soon. We've got the health priority, we've got the climate change needs, and we've got education, which has fallen behind because of the pandemic, and we've got to catch up on this. And if you look at the aid budgets, they're not going to rise quickly. Is the World Bank doing enough? My view, and I think you've got figures on it, Masood, you might tell us. It doesn't seem to have done as much as it did in the financial crisis of 2009-10. And I think we've got to look at whether the World Bank is doing enough, using its funds well enough, and what could be done to persuade them to do more. I also feel that we've got to look at how we can mobilize private funding more effectively, and Vera was talking about that as well. I've been very interested in guarantee-based facilities. So governments will be stretched on their international aid budgets, but they are in a position as AAA or AA countries to give guarantees. And the guarantees would allow the World Bank or others to borrow more money and to be able to make money go further. And I think we have got to be far more imaginative about how we use it. And interestingly enough, the guarantee-based facilities we've been talking about have got a far greater leverage than the World Bank itself. And we are going to have to create the resources that are going to be essential for these three big functions. And this is not including general infrastructure, not including anti-poverty reduction, but education, health, and obviously climate change. So yes, we've got to look at new ideas. The one thing that I would caution against is that my experience as a finance minister and as a prime minister is that while the World Bank and the IMF and the United Nations and the WHO can do really important jobs, that leadership in getting resources urgently to places that need them, which is what we're talking about at the moment, has got to come from those countries that have the resources. And that's why I put more accent and emphasis at the moment on getting America, the European Union, United Kingdom, Canada, Japan, and these other countries to step up to the mark. Because if they start giving some leadership in this, whether it's to vaccinate or for climate change, you know, we haven't got the 100 billion climate fund that was promised in 2009 yet on climate change and on education. If they step up to the mark, then things can be done. So let's look at guarantee-based facilities. Let's challenge the World Bank about where its resources are actually going at the moment and whether it could do better. And let's also look at whether the political leaders of the large countries, either through the G20 or the G7, can step up to the mark urgently, because my sense is that we are going to look back on a year or two from now on the waste of time when there was urgent needs that could be met, there was vaccines that could be delivered, there was a potential to get them out there, and we just didn't do enough. We've really got to think about how we can speed the process up.
Right. And I wanted to just follow up on that for 1 minute and say, so this idea of using innovative financing facilities, you've had this, the one proposal in education of essentially using guarantees to provide a basis for the World Bank and other development banks to scale up their funding in that area, and that gives a leveraging that's multiples of what you would get by putting the money in directly as capital into those institutions. And you know, this idea has been around for a while, and yet there seems to be in the IFIs or in the MDBs a sort of degree of reluctance to take on the sort of new innovative uses of balance sheet in the ways in which you're talking about them, and others have talked about them, put on various other ideas as well. And I want to come back and ask you, because you've sort of been at the center of this for so long, Gordon, do you think that this can happen from within the machinery, or is this essentially these kinds of step changes can only happen if the main shareholders drive that process of change. Because I sort of wonder, sometimes we sit on the outside and we sort of look at the institutions and we say, they're not responding or they're a bit reluctant. But how much of that is them anticipating what their main shareholders want, rightly or wrongly?
Well, I think it's there are great ideas come from within all the institutions. Path-breaking initiatives are always coming. But if you're looking for the creation of new resources, then the World Bank will probably tell you, give us more IDA. Let's do something with an enhanced IDA or something like that. And they are not thinking, in my view, about how you use the whole financial system more effectively. So I would say the World Bank has been pretty conservative about what it wants and what it's going to do. And I think that there are new ideas around that should be taken up. But again, I come back to this. If the World Bank can't do it on its own, or the IMF can't do it on its own, and it's very difficult for administrators to take these big political decisions about the release of more resources, then you've got to have America, Europe, the leaders of the G20, and you've got to have Africa and the other countries pressing them to do something. I want the political leadership to be more effective in this crisis. And that means that we need more cooperation, but we need one or two leaders to come forward.
Yeah. Ken, could I just come to you? You sort of listened to what Vera and Gordon had to say on this. And can I also ask you, Vera said that the crisis is not over in Africa yet. We're going to have another year, and John will give us a view on that, but we'll probably have another year where we are still trying to get out of this under the best of circumstances. And yet, if you look at the conversation internationally, it's already shifting to the post-crisis economy. Sort of how are we going to organize ourselves? How are we going to have a recovery? And it's almost like, we've decided that we're done with the pandemic now. We want to talk about the world beyond the pandemic. Political conversation is shifting to that. How do you see that tension playing out? And to what extent can the fact that the crisis is not going to be over, the current pandemic is not going to be over for another year in Africa, get more central into the decision-making and the narrative for these upcoming meetings and for the broader conversation? And any reflections on that point also?
Yeah, thank you very much, Masood. I think that I remember in our first sort of meetings, I said this is not a passing frigate, but really an ice age issue, and it's going to take quite a bit to get there. And I guess with human beings, it's easier to normalize, so you can get back into your comfort zone as to how to manage this enterprise. But Africa remains where it is, and I'm not sure it's going to be 1 year. I think it's a long tail that we have to be dealing with. And I was in Washington a couple weeks ago, and it is obvious that people are looking to move on. I mean, you are in an institutional structure with certain rules of the game, with certain instruments that you are used to, and you are trying to perfect them. But the real question is, if we were to be looking 60 years ago when we put these institutions in place, and we were to reframe these institutions, what will the rules be? And I suspect it will become very, very clear that yes, these institutions are necessary, but what should they be doing? B, you need, as Gordon mentioned, great political leadership to be able to redirect and encourage them to be more nimble and responsive. But the big thing out of this equation is also the private sector. You know, we really have not sat down to look at this over $100 trillion that are underperforming, but due to certain covenants and mode of how we have set up the global architecture, funds flow is limited. So there's certainly enough money to go around for the type of profitability also to be given assurance to these pension funds. And I think there needs to be a concave really put together of the Larry Finks and Co. As part of the solution that will require, or else global productivity will never get to where it ought to get to. So I think that there has to be a certain coalition of the willing to truly engage the private sector to release this type of funding. Now, whether we can get the IMF and World Banks, etc., to really look at their mandate, given what we have learned in these past 50 years, I think it's imperative that we find a means of doing that to be able. So those are maybe the areas that give me hope that there are people who can get together and push the agenda. But certainly with the immediacy of what Gordon talked about the stockpile, I think our African leaders should certainly be able to get together with the UK, US, EU, and Canada to prove really that these vaccines are going to be useless to them, because maybe they truly don't know the inventory that they have, and bringing it, you know, to the leadership might facilitate that, because it's this information asymmetry and global civil servants just sticking to what they know, that then does not allow for the policy orientation or solutions that can be brought to bear. But I think there needs to be a lot more empathy about the nature of the situation. And as Gordon said, for the World Bank to move faster, for the IMF to really look at these instruments and realize that, you know, a little tweak might release a lot more for all of us to be in a better place than we are today.
And just to put a sort of one positive note on that, you know, this kind of raising of the profile of the issue of the one that Gordon, you put on the table about the vaccines that are likely to go to waste. If you remember, a few months ago, there was a similar conversation started about the vaccines that were being produced in South Africa and being shipped to Europe. And if I recall right, the numbers were about 20 million vaccines actually were produced in Africa and sent to Europe at a time when there was enormous need for them where they were being produced. And I think the kind of raising of that, of just the sort of inequity of that issue led to a reversal. And that demonstrates the power of the impact that this kind of profiling of a problem can raise. And I see very similar parallel there in terms of saying you've got 100 million vaccines that are going to go to waste rather than going to save 50 million lives or 100 million lives. And what is the possible argument for not moving now to airlift those and then the others that are also not going to be used, even if they don't expire by December?
Masood, can I send
I
the
know that this
Yes.
is a question for Gordon, but if I could just liven this up a little bit, because part of this, you know, give us vaccines is that we're getting vaccines 1 week to expiration. And so then the narrative becomes, oh, we gave them vaccines and they didn't use it. So I think we have to be very careful also about, as exactly as Gordon said, the transparency of where the vaccines are and when you're sending them and when they expire. Back over to you, Gordon, but I just wanted to make sure that
just to say, I will send it to you, Masood, and can you send round to everybody the report that's been done by Airfinity on these figures, which I believe are accurate, so that everybody has them. And I think it's very important that we see that where these vaccines are and what can be done with them. And you're right, if they are flown out too late, then the affinity argument is that 200 million vaccines could be wasted. So if you wait too long, then there's such a delay that another 100 million could be wasted. So I want to get these facts and figures out to people. And if you can organize that, Masood, I will send it. I'll send the documentation around.
Definitely, and you know, if they're public, if they can be made publicly available, I'd be very happy to just post them on our website for anybody who's interested. Because I think, you know, and I want to. This is really is a good segue, John, to come back to you, which is, you know, how come here we are, early October, and we're still struggling to get a sense of the delivery week by week, where in Africa, which ones are going to be coming in, and the numbers are still a little bit fluid, you know. So
well,
a year and a half. The
reason, Masood, is that COVAX does not have control over enough vaccines.
Right.
It's America and Canada that have overordered, and they've got delivery contracts waiting to be honored, and they've got to switch these delivery contracts to COVAX to enable them to get them out to the rest of the world.
Right. And switch them to later for themselves. You know, they could just swap dates as well, because we have a lot of numbers of donations, but not very good visibility on the time, the schedule for the delivery of those vaccines. So, John, your thoughts on that, and I also want to get your reaction a bit to, you know, there's one reaction that I hear more and more, which is, you know, this. Look, the capacity to utilize these vaccines is very quickly going to become a constraint, and no doubt that will be the case in some countries. But we must remember that actually Africa, you have been running, African policymakers have been running vaccination programs for a long, long time. And so in your sense, how worried should we be that the vaccines will run into an implementation bottleneck? How many countries is that likely to be a problem? What can be done to fix that before the bottleneck comes and hits us? You know, what's the advanced planning on that? You're on mute, John.
How did I get to unmute to a mute? The advanced planning is predictability of access to vaccines. We need to know what types of vaccines are they coming, when are they coming, and what is the frequency of that, so that you can engage the population and then prepare them for the kind of vaccines that they have. Let's keep it simple. This is not some rocket science about rolling out vaccines. These same discussions happened 20 years ago when they said, oh, Africans cannot use ARV, that is treatment for HIV, or they don't even know how to read time, or they would not be able to. And ARVs, I mean, they demonstrated once they became available that we could even do better. You need four things to do, I mean, for vaccines roll out. The logistics. How do you get the vaccines from the airport to the remote areas and whatever? That is not difficult. That is not, it requires money. You need the human resources, okay? You beef up the human resources, bring out nurses, bring young students, medical students in their last year of medical school. I was in Morocco 4 weeks ago, saw exactly this playing out. Brought in the military, they were, within 5 minutes, somebody could go around the circuit very quickly and get out of the sports complex. You need to mobilize the community and build trust in the community. Religious leaders, talk to them. Just last week, we had a very interesting scenario in Cameroon where just engaging with the religious leaders after church services, you could see a large amount of people queuing up to get their vaccines there, okay? And this is people that have been characterized like vaccine resistant to vaccines. They just need a trusted figure to tell them, go get your vaccines. And then the trucks are out there waiting to deliver vaccines. You need good information system to track how people, if you get those things, you get vaccination done. Okay, I mean, we are seeing in Togo, the Minister of Health of Togo called me last week and said, John, I'm running out of vaccine. I'm vaccinating 30,000 to 40,000 a day in Togo. And I called Seth Berkeley, we are scrambling to find vaccines for Togo. So you see that pattern across the continent, whether you're in Rwanda, Zimbabwe, and other countries. Morocco is around 55% vaccinated now. So it can be done if we know exactly when vaccines will arrive. And of course, if the funding is made available. So we should always think of vaccines and vaccination. vaccination are the 5 or 4 elements that I just listed. Is that difficult to roll out? Very, very possible to bring that up, but we have to do that as a program. Okay, the way we are treating vaccination in Africa is like you're treating a malaria, rolling out anti-malaria programs where you treat a little bit here, then no, that is not it. I mean, you're dealing with a virus that is fastly evolving, variants are emerging. We've had the luxury to deal with Delta for the last, since April, when Delta emerged. You truly don't know tomorrow what will emerge. Okay, it might be a deadly variant that will emerge tomorrow because we are just kind of very, very slow in the way we are doing this. I think Gordon said this, I said, we've wasted the opportunity. My greatest fear is that Africa is slowly moving into endemicity. I think we should just say it the way it is, that we will not be able to eliminate this virus. You will not be able to control it. We just have to manage it. I think that is a very scenario that in January or so, we should be preparing, we should be candid with the ministries of health and the government and say, look, we are in a situation where you just have to manage this together with HIV, TB, and malaria. That's not, I mean, what a scenario that we want, because we wasted the opportunities. If those vaccines were here, the 300 million doses that would potentially expire in some countries, we would have been able to roll that out and use the major cities as a strategic point to break the backbone of this pandemic. A lot of this, the burden, the caseloads are still in capital cities. When they see themselves into remote areas, we should be able to throw our hands up and say, look, there's not much we can do with this. 60% of cases of COVID are in Addis Ababa. Okay, so that is where you target those capital cities with those vaccines, the Pfizer, the Moderna, vaccinate at speed, at scale, and break the backbone of the pandemic. That is not what we are doing because we don't have the vaccines.
Masood.
Again, I was going to come to you. Yes, please.
Yeah, I think the sad part of it is, is the old argument, are you ready for independence? It's like, really? I mean, how can we not be ready to receive this as an excuse? But I suspect maybe one of the asks, in addition to what Vera was talking about, is to be really categorical at the annual meetings about, finding the resources to airlift these vaccines that may expire, within a certain period. I mean, we saw the US move in a week or so in Afghanistan to our shock in terms of getting people out. So there's the capacity to do that if a decision is made, even at the annual general meeting, resources are given for distribution. Then John takes over in Africa, and we can get it done and break the back of this. Because the issue of indemnicity then becomes problematic. You now add in malaria, TB, etc., and now this, and that will be problematic for a long time.
Absolutely. So financing that you've raised, John, you raised financing is what's needed to get those things in place, which are, if you like, the downstream end of once the vaccines arrive, how do you actually go forward, and visibility and predictability on when the vaccines will arrive so that you can prepare that accordingly. To what extent is that financing now being handled? I mean, so for example, if you were to talk to your colleagues calling you from the various countries, the health ministers, the finance ministers, are they looking for financing in the near term for that part of the work that you outlined? And is that something that is coming from the development banks, from reallocating money from their own budgets? And it'd be good to get the thoughts of Ken, Vera as well on this point. So John, anything that you could say?
I mean, as a health person, I'm always the last to know where the money is. I think the Ken and the Veras know where all the monies are hiding. All I know is that I need money, and I've never been to a country and the Minister of Health tells me that they have money. They always tell me that they need more. So I'm polite not to even push them that. I mean, I just know that everybody you talk to, they just need more money. But I think Vera and Ken knows where all the monies are hiding.
So let me turn to Ken.
I mean,
Ken, finance ministers always are worried to talk to their health colleagues. They try to not return their calls because they know that almost invariably it'll mean that they need more money, and the cost of not giving them the money is really high, and yet you don't have the space in your budget. So are you calling? Are you responding to your health minister's calls these days, or how are you dealing with this?
Yeah, Masood, I think really there's now some degree of nexus between the ministries of finance and health because the examples are clear. And I think philosophically, finance ministers have sort of moved the issue of healthcare from a consumption level into an investment level. And that changes the perspective as you look in your budget and how to allocate. But if we look at this globally and, we are able, the world is able to fund these vaccines to COVAX and help them with distribution to ourselves, we look at our budgets to see what we can do to facilitate that. And then, of course, with the change in the structures that Vera is talking about, to be able to get funds at rates that make sense for us to invest in our healthcare. So those are all kind of fundamental shifts that are necessary, but at least on the ground, I think most of my colleagues have now changed the philosophy of consumption into one of investments, and that has brought us closer together to save lives and livelihoods.
One of the things that I always felt was that the distance between the of interaction and contact between the health ministries and the finance ministries historically has been one of the weak areas in the way a lot of countries that we've managed economy. And one of the changes from this pandemic is, in a way, the recognition on both sides that global health and national health really has to be much more central. And the finance ministries also have to have a role in that. The G20 sponsored panel on pandemic prevention, preparedness, and response, which just came out with its report. And as you know, that Vera was a member of that panel, as was I. And one of the main recommendations of that panel actually is that going forward, in terms of pandemic preparedness and prevention, you really have to have a bringing together of the health and finance leadership in countries in ways that ensures that there's this strategic dimension of health security is recognized. And I think trying to follow through on that in different ways will be a key part. Vera, I wanted to come back to you on that point, and also you have been bringing together health and finance ministers, if I understand correctly, in the ECA context. Was that easy? Or did you find they were talking a different language? How much are they now able to interact in that way?
No, I think, thank you. And this is part thanks to John, but also thanks to Strive Masiwia. And I think and Ken is living proof, right? Ken gets a vaccines bill and he goes, oh my God, I can't pay for it. And then he goes, can I get it someplace cheaper? While his Minister of Health is asking to get it yesterday, he's thinking, how can I get it yesterday but cheaper? And I think that has brought these two hands together very quickly. I think also the fact that, under the African Vaccines Acquisition Task Team, we were able to demonstrate, one, that, Africa could come together, get a sense from the health ministers of what the needs were for vaccines, find a platform that pool procured and reduced cost, interested finance ministers. So finance ministers needed to go to their health ministers and say, what kind of vaccine do we need? When do we need it? But because they could see a more transparent and sort of collective platform, they were able to put it together. So it started, I think, with political leadership from, President Cyril Ramaphosa, an active engagement. Unfortunately, Gordon is not here, but we as Africans brought together the private, something we're struggling to get the global world to do. We brought the private sector, the the Afro-Exim Bank, with us and the African Economic Commission, the Commission for Africa, and John, who is the doctor who tells us which vaccines we can buy and not buy at what point and what's herd immunity. We've gone from 60 to 70%, so we can cost all of that and go out and get it. So I think that conversation has made health and finance ministers talk more together. But part of the reason why I think health and finance ministers had not been talking together is a deeper and more fundamental problem. And that was that a lot of Africa's healthcare was financed externally, was donor financed. So in some sense, the finance minister just did the budget and said, how many are we getting? How much are we getting from PEPFAR, from Gavi, from this, from that? And we only focused on essentially healthcare was financed by the donors. We didn't finance healthcare ourselves. And that seemed like an interesting option. However, if you look at some of the statistics, you see that 4 of the vaccines that sort of hurt and kill most of our kids, and I can't name them because John is here, so I speak with under his control. I think it's rubella, malaria, and 2 others. The total global production of those vaccines is about $13 billion, right? We have about 250,000 African kids that pass away from this. We could actually produce that on the continent, but we never even think about producing it on the continent because somebody just always gives it to us, quote unquote, for free. But it's not really for free because when we don't have it, our kids die. And I think the cost of the life of any one kid or any one mother is way beyond that. So I think what COVID has done is not only has it brought African finance ministers and African health ministers together, it has brought our private sector to the table because we're beginning to say, why don't we produce these things ourselves? Finance can give you, some guarantees, as Gordon was talking about. The World Bank, the IFC can provide guarantees for private African production, which creates jobs, keeps us healthier, and ensures that we can finance our sector. So it's not just about domestic resource mobilization to increase costs, but it's actually about reducing costs because we can do more preventive medicines. We can produce them on the continent and ensure that people get them.
Great. And in a way, you could argue that we're talking about health and finance ministers and ministries coming together within countries. But frankly, if you project this out into the international system, it's a pretty fragmented landscape where you have a number of, and John, I see you're shaking, nodding your head, but if you look at the international system, you have a number of health-focused organizations. Some of them are disease-focused rather than, their structure around diseases. And then you have a lot of money, in fact, if you look at it, coming through the international financial institutions into this scheme. And it's not always been the case that, the coordination and interplay of the work across these agencies has been there. So sometimes there's been, kind of fragmentation there. So I would say that that's another area that we can think about. Before we end, I want to quickly just come back to each of you and say, do you have a sort of closing message that you want to send to the viewers on this and to people and to the policymakers in Washington? We're all going to be meeting in 10 days' time. So, John, can I start with you? What's your message?
Let me start with my fear, then I'll conclude the message that over and over, we've seen how memory is short. I think Ken touched on this. When Ebola hit West Africa, we said never again. And we did all kinds of planning, reflections, very nice reports were written. And immediately it was over. None of that was ever implemented. I think if we waste this opportunity, we will pay dearly for that. Something tells me that Ebola was a signal to us that something big was going to come, and we've seen something big. But unfortunately, we are beginning to normalize deaths. Okay, we think, who could have imagined just 2 years ago that about 5 million people would die in less than 2 years, and about 200 million people will be infected by a virus that we just didn't know exists. But I can argue that we are beginning to normal, as you said. The conversation is moving on to let's talk about the after pandemic, whereas we are still very deep in the pandemic in Africa. So that is my fear. So I think that whole short memory period where people react initially January of 2010, we were still very scared. Everybody was scared. I mean, about now we are beginning to come out and act as if this is over, and if the 100 and the 212,000 deaths in Africa. And if someone had mentioned at the start of this pandemic in 2020, we all probably have been running away there. So I think that is my fear. But I'll say this to, and maybe my comment is redirected to Ken, that you should plan for the long term. I mean, for Africa, this is not going to go away next year. When this thing just started, we said, well, 6 months, maybe 6 months, we'll be out doing our stuff. I think, Ken, you should be thinking of working with your health minister of getting the vaccines that would be enough just to vaccinate a sizable population, but repeatedly, because we see this as all I do is I analyze data from vaccines. Today, I spent half a day looking at J&J vaccine because I told Johnson & Johnson that you have to open your books and show me how antibodies are decaying, but clearly they are decaying. And at some point, we really have to just to be honest and say, at what point do we need to be revaccinating? So I think that will require money. So my message to you, to Washington, will be that we think.
I think John is frozen on that. Oh, sorry, John, we missed your last bit. You broke up. You just said your message to Washington will be
is that we should plan to solve the immediate problem now, but we should know that this is not going to go away within 1 year or 2 years in Africa. I think we are in, because of the delay that we've had in introducing vaccines, we'll be dealing with another 2 years to 3 years before we see the light at the end of the tunnel.
Thank you very much for that. Ken, any final thoughts for?
Yeah, so thank you very much, Masood. I guess really for us, the issue, of course, front and center, and therefore, we estimate, maybe about 14 billion without the 24 billion boosters that John is talking about, economic decline. It costs us another 150 billion from our analysis. Then there's a 425 billion gap. Then you have real jobs increasing from 100 million people down, and then the extreme poverty issues that are upon us. And then when you look at our debt issues elevating, you have a new 11% cost that we have to put into the reality of what we do, another $5 billion worth of increased, exposure. So these pose challenges, and it's not an issue that is going to leave us right now, but it's really a historic opportunity to rethink, the global sort of economic cooperation, more based out not of might and tribe and hegemony, but sort of mutuality and sustainability and the collective good. And putting our minds around that, I guess, is what we should be fighting about. And for the IMFs and World Banks to really think differently. But I think world leadership is really challenged to understand the collective will, the public good, and our common humanity is the problem. But certainly at this annual general meeting, the issue of vaccines that are going to expire, I think we should have a special program to get these to our people. But it's scary to think of the indemnicity that John is talking about, because then we've added another problem for 10, 20 years also, which will impact all of that. So we need some coalition of willing minds to really tackle the foundations of our current institutions and also find people to really and truly engage the private sector to unlock the funds flow which will enable Africa to have the resources at reasonable cost to then be able to build better and forward.
Thank you very much. That's very clear and very inspiring. Vera, your final message to the meetings here.
No, I think thank you, and this has been very rewarding. First, very, very refreshing to hear Gordon, talk about the private sector and the need for better intermediation with the private sector. I really think this is one of the big lackings of how we're trying to solve this crisis. I always say, at the end of the First World War, we created, the League of Nations. We killed the gold standard. At the end of the Second World War, we created the Bretton Woods institutions. Yesterday, we saw that Farid, no, it wasn't Farid. I think it was. He came out with a book called World War C, right? So we just have a new world war. And I think we do need to think about how we use our institutions differently. I don't think we need to create new institutions, but maybe their mandates really need to be looked into. And I think that Ken and many of us have been talking about, do we need to look at this differently and ensure that we can crowd in, because we know the public sector does not have the kinds of resources that are needed. The second thing is about, if you read the Financial Times this morning, it's all about rising prices of fuel, right? And the argument there is about, oil producing countries saying, we haven't, it's the highest, it has reached its highest level in 7 years. South Africa is paining, Turkey is paining, emerging markets are paining, particularly the oil importing countries. So we have another crisis in our hands. And then there is a conversation on inflation, right, in the United States. And so it just seems as if we're now talking, we're having different conversations. All the conversations in the US is about the infrastructure bill and the oil prices now. And, the rest of us are still talking about vaccines. And I think this kind of what I call dynamic divergence cannot persist for too long. Because actually one of the reasons the OPEC plus countries are saying we're going to put oil prices up is because they want to recover too. And so they're saying, well, you've given yourselves trillions, we're going to put oil prices at 100, it's now at $80 a barrel, and make sure that it hits 100, and we're not increasing production. So I think there is this lack of multilateralism that is making the system very difficult to come together. And so we do need to look at that as well. But that takes me into the recovery. Even when we get to the recovery, I think then the conversation also has to be slightly level playing field, because we see the OPEC countries increasing fossil fuel production. We see the big US oil companies increasing fossil fuel production. How can we create a different kind of coalition, where John Kerry and everybody else, the Chinese have just said they will no longer fund coal externally out of China. Can we create a different kind of coalition that tells us that sustainability really goes through, doing something green? But for Africa, it's about resources again. It's about getting a price for carbon. Can we get a price for carbon that will allow Africa to get more resources in a way that is deserving and not in a way that is, again, begging? And I'm closing as I started. Let's not focus too much on the grants and the donations and all that. I think what Harvard has shown, the African Vaccines Acquisition Task Team has shown, is if you can put your resources on the table, you actually command the dialogue. And I think Africa is getting to that point now where we want to be able to put our own resources on the table and command the dialogue. But that goes back to putting a price on carbon. That goes back to putting these institutions in place that ensure that we can do it in a sustainable fashion.
Thank you all very much. And thanks also to Gordon, who had to leave. I think this has actually been very timely, as I said at the beginning, because there is a danger that the main conversations at the upcoming sets of meetings become conversations that are very relevant for a subset, but which then relegate the remainder of how to deal with the COVID crisis as one of the development issues facing Africa. And we just sort of park it there and it goes off the main table. And I think what you all have demonstrated is that not only is that a central issue for Africa, but unless we are dealing with that as a global issue, it's going to come back and really be a sting in the tail for all the other plans that people have. And Something we haven't talked about, but which I think is worth saying, is that one of the casualties of this whole crisis has been a loss of trust in the functioning of the international system. So a lot of people are no longer as convinced that the rules work for them in the way that they had expected them to work. And I think that loss of trust needs to be regained for us to be able to address any of the subsequent challenges on which we need to cooperate together. So I take you up, John, on your initial thought that we should reconvene in 6 months' time. Ken, if you're up for that, and Vera, we will have the third edition of this conversation in 6 months, and we'll bring Gordon back into it as well to see whether, in fact, in the next 6 months, we have been able to address some of the challenges that you have put on the table. Thank you all for your time, and excuse me, and thanks also to all of our audience that has been listening in to this event. So with that, I'd bring this to a close. Thank you.